Hello, and thank you for tuning in to Answers from the Lab, where we share Mayo Clinic knowledge and advancements on the state of testing and science from laboratory leaders and the people who are making it happen behind the scenes. I'm Dr. Bobbi Pritt, Interim Chair of the Department of Laboratory Medicine and Pathology at Mayo Clinic in Rochester, Minnesota. With me today is Dr. Bill Morice, the President and CEO of Mayo Clinic Laboratories. This is our weekly discussion with Dr. Morice, in which we learn about updates in the field of laboratory medicine and pathology.
Hi, Bill. Welcome back.
Hi, Bobbi. Good to be back, as always.
As always, it's excellent. And there's always lots to talk about. I was very intrigued to read an article on health equity written by you. It was an excellent article in Lab Manager called Health Equity Starts in the Lab, Empowering Labs to Bridge Health Equity Gaps by Enhancing Patient Access. So I thought we could talk a little bit about that. You raised some really important points that I'd like to share.
Oh, that'd be great. I mean, it's a topic that, we don't often think about in the laboratory, but I mean, for me, it really was during the pandemic when it really kind of made me just think about, about this topic. And it's one that is really important. So yeah, let's dive in.
Excellent. Well, I'll just start by saying it was published in Lab Manager, which is an organization that produces online and print publications. So this is free access. Anyone can read it. I think you might have to enter your email in order to see the whole article, but it's otherwise free, and we can add a link to that. They do a lot of other great things too, lab quality operations. So it seemed like a perfect fit with the article. And I really liked how you set the stage that health equity is still a major challenge. Of course, like you said, we saw that during the pandemic, who gets tests, who gets vaccines. But I was optimistic in seeing that your view of that the clinical lab is making strides towards addressing healthcare equity and access issues. And really, we're so well positioned to do so because we have more touch points than any other outpatient service line. So I don't know if you want to tell me a little bit about what you were thinking when you were inspired to write this.
Yeah, well, I mean, so first of all, it's for us, to start where you ended. I mean, in the laboratory, and I really, as I had the privilege, we both have had the privilege to serve as a department chair for lab medicine at Mayo in Rochester. And you realize, if you didn't already, that the lab touches essentially every part of medical practice. As I say, from cradle to grave. And if you pointed out, from before the cradle to grave, you also have prenatal testing, which we do a lot of. And so the lab is essentially a continuous partner, right, in your healthcare journey throughout your life. And so it would seem logical then that if we're really thinking about people having access to care, we would think we would start with the lab. But honestly, like as you and I've talked about, it might not be evident to many people who are in the clinical, sitting in front of a patient or in a a wellness clinic or something someplace, that the lab has such an important role because they're interacting in a very focused way. So a reason I like to talk about it is that as soon as you say it, I mean, it makes perfect sense to people, but it really is going to be a team sport, right? Where we have to think about all the different settings where people are accessing care or need to access care, and then being present in those locations and thinking about the so-called healthcare deserts where people haven't been getting care and where we can really help and where diagnostics can make a big difference, which I think, again, is kind of what COVID, pointed out to us.
Well, let's talk about some of those healthcare gains because in some of those in those healthcare deserts, we have made gains. Hold on one second. I'll just ask Rick, why am I echoing weirdly?
It's because it's coming through Dr. Morice's speakers. So yeah, I'm recording independent audio channels, so I will be able to basically delete his when it's getting that feedback. So if you can ignore it.
Okay, I'll ignore it then.
Yeah,
that's good to know.
I can fix it. Yeah.
Okay, thanks, Rick. I should have known that you're all over it. Well, let's talk about those healthcare deserts that you talked about, Bill. There are some gains, things like mobile clinics and at-home tests. Do you want to talk a little bit about how those can help in areas where people may not have access to a local hospital?
Yeah, so I mean, I'd love to, right? And I think this is something, again, that I started to think about when I was during the pandemic. As I was part of an industry advisory. I led an industry advisory group to the efforts being made by the nonprofits, the Bill and Melinda Gates Foundation, the World Economic Forum, others to grow access to COVID tools, right? And this was primarily in low resource settings, so low and middle income countries. So point of care, point of need testing, self-administered tests were a big part of that. And sitting at this interface between what was trying to be accomplished from a global health perspective and the industry and the diagnostic manufacturers, kind of realized two things were going to be happening. Number one, people are investing in ways to actually interact with individuals outside of the traditional healthcare setting, setting up walk-in clinics and other things. Plus, the manufacturing base for these diagnostic tools was being dramatically expanded, with COVID and with investment from both public and private sectors in this. So this kind of created the perfect environment. And last but not least, I think a willingness of people to actually use them, right? And you and I talked about this together, and I know you were a big part of this, have been a voice for this for a long time, and it's certainly during COVID. People are just much more, it's more part of people's natural way of thinking about access to diagnostics as a self-administered test. And so what we've seen is a combination of clinics, walk-in clinics, some kind of facility or infrastructure to reach some of these so-called healthcare deserts, and then the availability of self-administered diagnostic tests or point of need diagnostic tests, some of them free. We've had these programs from the government, and now we're seeing it start to penetrate in other areas. You and I think, talked about in one of our previous podcasts, the potential self-collection for cervical cancer screening and stuff like that. So I do think that these are great. We think of them oftentimes as convenience, but from a lot of places, this is going to actually create access. It's not beyond just convenience. It's actually delivering healthcare.
You mentioned the one thing I was going to bring up again, cervical cancer screening through HPV screening. We now have FDA approval for self-collection of a vaginal sample in a licensed healthcare provider's office, but soon we anticipate that's going to be at home. That could be a game changer. Women could have an easy collection device mailed to their home on a regular basis. If they're at risk, that regularity could be changed to be more frequent. And this is something that people often are just not very good about getting to their healthcare provider, especially for something like a pelvic exam, which could be sensitive and not very popular. So that's just a start. And then you can add on to that screening for sexually transmitted infections, doing it from the comfort and privacy of your own home and not having to go to a healthcare provider and being asked a lot of questions that may be seen as intrusive. Of course, there's downsides. You want to have that patient touch point with your healthcare provider, but I think it's actually going to increase access for so many people.
And not only access, but also the equity, right? Because both,
yes,
there's big differences. And I've talked about in cervical cancer, has a higher incidence in populations that have less access to healthcare, and in certain minority groups. Same with sexually transmitted infections. You and I talked about syphilis and its resurgence. That's been in areas of our country and of our globe where people need more access, more attention, more education, and all those things can go along with this type of. But most importantly, testing is really what gives us the insight to know what's going on and help people know what's going on.
Yes, and you also mentioned AI as having some opportunities for gains in this area of equity, but also perhaps some concerns.
Yeah, so because the other thing you talked about, is how do you create that touch point? I was just at the Becker's CEO and CFO conference yesterday, and we could talk about, there's still a lot of discussion around interactions with providers and all these sorts of things as we move to more virtual care. So on the one hand, AI can do a lot of things there. It can look at public health data and help us understand where there's needed access to testing. It can sit on top of the data coming off those tests to help direct next steps for individuals and for patients. And what we're seeing now even is, with generative AI, are actually, voice enabled or voice activated chatbots, for lack of a better term, that would give someone the ability to interact with the healthcare system in a way that's convenient for them. So those are all, really cool things that could be, with the testing growing access. The concerns, of course, are around how those tools are built, what kind of data is put into them, that there's just an inherent possibility for bias in all those. So that's where you get concerned about, is it going to counter, is the intent going to be good, but the execution be flawed because of something in the way that the data and the tools work. And then, of course, we're going to have to strike the right balance between privacy and some of these other, convenience or effectiveness in healthcare delivery, as you pointed out. People are going to be variably willing maybe to share some of the data or not comfortable with their data being shared. So these are all things that will have to be kind of sorted out as we go forward.
I agree. It's such a fast, rapidly changing topic, and so many strides are being made in generative AI specifically. I would add that I think also having generative AI be able to translate patient reports into multiple languages, or changing the report so it's understandable to a patient, that would help increase access, perhaps equity, people understanding what their report actually says in clear ways that tells them what some next steps might be. But it's not without risks. So
That's right.
this is
And it's
the
not,
future. Oh, I was just going to say this is the future, but perhaps at this point, it's still very early on.
Yeah, and I think the most important thing, Bobbi, is that these are all tools, right? But the basic, whether they're the at-home tests or the point of need tests or the AI or all those things, but they're tools that require us as laboratory professionals to help guide how they get used in healthcare, right? So we're still the people that help guide who needs a test, where is the test needed, what is it good for, how do you explain it, what next steps should be. I mean, so we have to be watching these changes, but we have to really be actively engaged. And I do think that there's a willingness now for people to come together. I did a little thing on innovation yesterday. That was my panel at this conference, and I said I came to the conclusion when I was there actually, and said it, is that innovation in healthcare is definitely a team sport, right? And the laboratory and all of us in our profession need to be an integral part of that team to make sure that we keep the patient and the needs of the individual patient and the society at the center of anything that we're doing.
That's very well said. When it comes to AI technology, we always talk about the human in the loop, maintaining the human in the loop. Maybe we should say the laboratory leader in the loop. Is that
Exactly.
too much alliteration? I don't know.
I was thinking the same thing. Glad you said it, not me. I haven't been tongue-tied.
Well, one other thing that you mentioned in your paper that you wrote is the collaboration between health systems and how that can also help with healthcare equity. And you had given a nice story of a county-owned medical center in rural Missouri that expanded its operations, opened several new laboratory draw sites, helping with that access, but then how that laboratory realized, that health system realized it didn't have to do everything and could partner with other laboratories to offer certain tests and perhaps send out other tests.
Yeah, no, thanks for pointing that out. I mean, when I say innovation in healthcare is a team sport, it's between different entities like diagnostic manufacturers in the labs, payers in the labs, etc. But it's also between labs themselves, right? Because innovation is really driven to solve local problems. And the local problems are different in different parts of the country and in different healthcare settings. So that was a great opportunity for us to work with a healthcare organization that really wanted to increase access to care in their environment and for their patients that they serve. And we helped to think through that with them about what that might look like. And as my vision for the future, really around diagnostics, is probably going to be multiple sort of tiers, if you will, where there's going to be more at-home testing. There's going to be more patient-generated or patient-collected specimens that get sent in. Those will come in, and then there's going to be more, ambulatory settings. Ambulatory care is certainly taking off in this country. That'll have a layer. Then there'll be a hospital, and then there'll be a tertiary hospital or reference lab like Mayo Clinic in the Department of Lab Medicine and Pathology. So thinking about how that system should work is something that I know you and I are both passionate about, because it really has to be designed together, and it has to really be designed to be sustainable and scalable so we can serve as many people with high quality care as possible.
You did mention some ongoing challenges at the end, things like the need to think collectively about how to make tests more accessible, getting back to that idea of working together to really come up with these solutions. How do we meet people where they are? How do we make testing that's accessible and affordable? do you want to share a little bit about your thoughts on that?
Yeah, it's essentially, it takes so many things. It's for a test to actually be available to a patient, and as you go along the bucket brigade, that each time there's a new hurdle or a new barrier, right? So from a regulatory perspective, what are some things that we can be doing in the regulatory space to think about innovations around, AI? We just mentioned that's a real hot topic all the way around, and also just in tests that are out there. There are new ways. We've seen the FDA regulation of lab developed tests, which we've talked a lot about. So are there innovative ways we should be thinking about assuring safety for people that are served, but not making things so difficult to get approval, things like real world evidence. And then the other is, of course, around reimbursement. These things need to be paid for. I mean, it's great that the cost has come down for some of these technologies and that some of them have been made available through public programs, but still in all, we have to think about, some novel ways to reward the lab so that this kind of activity is sustainable and scalable, as I said before. So those are things that we need to be engaged on multiple fronts, right? Both in that we need to have one foot in the hospital or wherever the patient's being seen or served, and then we have to have another end, all the other things that need to happen for that test to actually be available for a patient. What I would say administratively is probably the correct term, although it sounds a bit dry. It's really thinking about just how do you get things approved and paid for.
It's important. It's all part of what we need to look at, the whole picture. Well, thank you again for sharing your thoughts on this and the paper that you wrote. And again, we'll put a link in our with this audio and podcast so that people can read that if they want.
Yep. And thanks for asking about it. I mean, it's something I think is super important, and it's a real pleasure to speak about it, and just and work together to actually bring some of these great things that are happening to fruition.
It's an important topic. Well, thanks again for joining us, Phil.
All right. Till next time.
See you next week.
Thank you so much for tuning in to Answers from the Lab. Be sure to subscribe to this podcast and don't forget to tune in every Thursday and every other Tuesday.